Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is on chronic lung disease and exercise. Following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in-depth guidance and advice. Let's get started. Chronic lung diseases are common in cancer survivors due to smoking history, radiation, and treatment related side effects. Conditions like COPD and pulmonary fibrosis affect how well we breathe, but exercise remains one of the most powerful tools to support lung health. In today's conversation, there are three types of chronic lung diseases that we'll talk about. The first one being restrictive lung disease, which happens when the tissue in the lungs become inflamed, stiff, or scarred. And this makes it harder to inhale air because the lungs cannot fully expand. Obstructive or airway lung diseases happens when the airways are blocked or obstructed and it is harder to breathe out all the air in your lungs. The airway becomes inflamed, thick mucus can build up, and the walls of the air sacs become damaged. And then there's pulmonary vascular lung disease. This affects the blood vessels in the lungs, and this means the heart and the lungs have a harder time working together to circulate the oxygenated blood throughout the body. The first chronic lung disease we're going to talk about is chronic obstructive pulmonary disease, COPD. It is a progressive condition which include chronic bronchitis and emphysema that cause airflow limitations and breathing related concerns. The causes are from smoking, environmental exposures, history of lung infections or inflammation, and past cancer treatments, specifically chest radiation. Exercise benefits are mainly improving the body's use of oxygen, improves shortness of breath, and improves cardiovascular fitness and muscle strength. You might feel like it's not safe or even possible to exercise with COPD, but the right amount and the type of exercise has many benefits. So, for example, exercising for too long or too intense may cause injury or shortness of breath or other COPD related symptoms. If you do not exercise regularly, I recommend gradually increasing the amount of time that you exercise. And each person may have different exercise goals, but in general, moderate exercise for people living with COPD, maybe 20 to 30 minutes of exercise for 3 to 4 days a week is the recommendation. Pulmonary fibrosis, a condition where lung tissue becomes scarred and stiff, reducing the lungs' ability to transfer oxygen. Exercise benefits include preserving remaining lung function, maintains physical endurance, and strengthens the heart and muscles, which help get more oxygen into the bloodstream. Other benefits include weight control, improved energy, reduced stress, better sleep, improved mood, and a sense of achievement. Move more to breathe better. You don't need perfect lungs to benefit from movement, and the goal isn't to push hard, but to move consistently. You should not exercise if you have a fever or infection, feel nauseated, have chest pain, are out of oxygen if you are on an oxygen tank, or have increased shortness of breath or worsening of other disease-related symptoms. And a few things that you should keep in mind is first to always consult with your medical care team before starting an exercise program. And you want to prioritize aerobic exercise, resistance exercise, stretching, and two others I did not put on there were balance and breathing techniques. Use oxygen therapy if prescribed. So if you, again, use a oxygen tank, make sure you are using it while you exercise. Avoid high elevation or very humid and hot environments. Watch for signs of low oxygen, such as lightheadedness, bluish lips, or confusion. And always listen to your body and rest when needed. Thank you for joining our conversation today on chronic lung disease and exercise. I hope the information has brought you clarity, comfort, and encouragement. Your health and well-being matter most, so please continue to take care of yourself and holding on to hope. Now let's transition into gentle movement. Today's routine is a sample from our Maple Tree On Demand library available on the Maple Tree Cancer Alliance app. Subscribe monthly or yearly to access safe and empowering exercise videos for every stage of the cancer journey. If you're ready to join today, click the link in the description or scan the QR code on the screen. Let's get moving.
I'm Jessica, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to week 2 of the 6-week low-intensity HIIT program designed for lung cancer survivors. This week, we will need a chair and an optional lightweight dumbbell. The goal is to increase your heart rate and lung capacity, so move at your own pace during these timed exercises. Remember, there should not be any pain. Always move within your range of motion. Let's get started. We'll begin seated, and just like last week, we'll start by noticing your breath. Take a deep inhale through your nose, imagining like you're breathing into your belly, your rib cage, your chest, expanding. Open up your mouth and exhale, sigh your breath out. Deep breath in, get as big as you can. Exhale, sigh your breath out. A few more times. Inhale. Exhale, let it go. 2 more. Last one. Take your hands to your thighs or your knees, and this time as you inhale, reach your chest forward, squeeze your shoulder blades together, and then exhale, round your spine, take your chin to your chest. Inhale, open up, finding this arch. Exhale, round. Inhale, open. Exhale, round. A few more times. Two more. Last one. Inhale, come back to center. We'll take our hands together at our chest, and we'll inhale, reach your arms forward, round your upper spine, and then separate your arms, bring them to the side and back to your chest. Take a deep inhale. Exhale, round, reach them forward, bring them out to the side and back to center. Inhale. Exhale, reach forward. Inhale, back to center. Go ahead and reach forward. Inhale, back to center. A few more times. Exhale, reach forward, round your upper spine, and back to center. 2 more. Good. Go ahead and release. And we'll take our arms out to the sides and begin to circle our arms backwards. Small circles here. Continuing to breathe. Maybe they get just a little bigger. And then we'll flip our palms and start to go forward, starting small. And get just a little bigger. Going as slow or as fast as you would like to. And exhale, release your arms, shake it out. Arms can be wherever they're comfortable for you. We are just going to make a fist, squeeze your hands together, and then open them out. Squeeze and open as much as you can. Squeeze together and open, feeling this stretch all the way to your fingertips. And squeeze and extend. A few more times here. 2 more. Good, shake them out. And then this time, palms straight. Turn your fingertips towards the floor and turn them towards the ceiling. To the floor and ceiling. We'll do this just a few times here. Bring some movement into our hands, to our wrists. And go ahead and release those. We'll take our arms out to the side, palms face down for now, arms in line with our shoulders, and then turn your palms face up. Turn them down and face up. And we'll do just this movement for a few times here. Again, continuing to breathe. Sometimes when we move, we have a habit of holding our breath. We'll do 2 more times. Good. Go ahead and release, shake it out, and then we'll stand. And for these next 2 exercises, we'll do each of them for a minute. If our balance isn't quite there for us today, we can hold on to a chair or a wall, and we'll just do calf raises for 1 minute, lifting up our heels, balancing on the balls of our feet, and then release it. And we'll start these in 3, 2, and 1. Begin. Lifting up and down. As you lift up, feeling the squeeze of your calf muscle. If it helps your breathing, you can inhale as you lift and exhale as you lower. We're about halfway there. I'm sure you're starting to feel it in your calves. We are almost there, just a little bit longer, about 20 more seconds. Just a little bit more. Keep it going. And release. Great job. Shake it out. This next exercise, this warm-up, we'll also do 4 minutes. And we'll step out to one side, bring the feet together, step out to the other side, bring them together. If you want to pick up the speed a little bit, you can make it into a hop from side to side. Your choice, whatever you're feeling today. And we'll start in 3, 2, 1. As we go through this movement, maybe you're noticing your heart rate increase, maybe your breath. That's okay. That is what we want. Making sure that there is no pain wherever we are in this workout today. We're about halfway there. Keep it going. Almost there, about 10 more seconds. And go ahead and release, shake it out. Great job. For the workout, we will be doing 30 seconds on with a 20-second rest today, and we'll do 3 rounds of the workout. The first one, if you do have some light dumbbells, we can go ahead and use these. And we'll be standing for all of these exercises. So standing with feet about hip distance apart, shoulders down and back and core engaged. Arms will be at an angle. So thumbs will point up. They're not out to the side and they're not in front. They're somewhere in between. And when you're ready, we'll go ahead and start lifting up our arms just to shoulder height and then back down. We never want to go higher. We'll start this one in 3, 2, and 1. Begin. Up to shoulder height and down. If you are using weights, going slow and controlled here. Feeling the muscles in our shoulder blades. We've got about 5 more seconds left. Good, great job. Go ahead and release. Place the weights down if you're using them. The next exercise, we'll tap your toes out to the side, back together, tap out, and back together. That'll be the next movement for 30 seconds, and we'll start in 5, 4, 3, 2, and 1. Go ahead and begin. Tapping out from side to side. And again, you're always welcome to hang on to a chair or the wall here in any of these exercises if we need some extra help with our balance. Good, and release. The next exercise will be a little bit of a balance pose. So it'll be opposite arm and leg. We'll take the right arm overhead and the left leg back just a little bit. Engage your core, release, and then we'll switch to the other side. Toe can always come down. And we'll start for 30 seconds. Keeping the chest lifted here. Feeling the core engaged. Balancing from side to side. Almost there. We've got about 5 more seconds left. And release. We'll rest for 20 seconds. The last exercise is we'll take our leg out to the side and back in. When you bring it in, foot can hover or it can be set down in between. We've got about 5 more seconds. And we'll go ahead and begin. We'll do each leg for 15 seconds and then we'll switch. Only lifting your leg as much until you feel that squeeze and switch to the other side. And release. Rest for 20 seconds and then we'll go through that 2 more times. If you have your weights, we'll use our weights. We've got about 10 more seconds of rest here, but we're going back to that exercise of bringing the arms up and back down. And we'll start in 5, 4, 3, 2, and 1. Begin. 30 seconds. Feeling the work in our shoulders as we lift our arms. Core is engaged here, supporting us. Chest is lifted. Got about 5 more seconds. And release. We'll rest for 20 seconds. And we'll go back to those lateral toe taps, bringing them out to the side and in. We've got about 10 more seconds here of rest. We'll start in 5, 4, 3, 2, and 1. Begin. Noticing your breath here as we move. Maybe it's starting to quicken. And rest for 20 seconds. The next one that we're going back to is that balance. So we'll take one arm up overhead, take the other leg behind us, and then we'll switch. We've got just a few more seconds here. We'll start in 5, 4, 3, 2, and 1. Begin. You can always take these toes and just touch them down if we're feeling off balance today. We're more than halfway there. 10 more seconds. Go ahead and rest. The next exercise we're going back to is bringing the legs out and in. Again, we don't have to go up as high as we can. Just go high enough until you feel the outside of your hip squeeze, contract, and then bring it back down. And we'll start in 3, 2, and 1. Begin. Remembering to breathe here. We're probably feeling this in our standing leg too. We'll switch. Almost there. And release. Great job. We have got just one more round of those exercises, and then we'll go on to our cool down. We'll rest here for about 10 more seconds. And if you've got those dumbbells or those weights, we'll go ahead and pick those up. And we'll start in 2 and 1. Bring the arms up and down. If it helps, we can inhale as we lift and exhale to lower. Knowing that as we go through these exercises and these workouts for these weeks, the breath is very important here. And release. Rest for 20 seconds. You can go ahead and set those off to the side. We are done with those. The next one that we're going to is those lateral toe taps. We've got just a few more seconds here of rest. And we'll start in 5, 4, 3, 2, and 1. Halfway there. Just a little bit more to go. And go ahead and rest. We are going to go back to those balancing. Next, raising one arm and opposite leg and switching. We've got a few more seconds of rest here, and we'll start in 5, 4, 3, 2, and 1. Begin. Again, feeling your core engaged here. Chest is lifted. Halfway there. A few more seconds left. And release. Great job. We've got just one more exercise left here, and that will be the legs lifting out to the side and back in. We've got a few more seconds of rest. Catch your breath, drink some water. And we'll start in 5, 4, 3, 2, and 1. Begin. You're probably feeling this in your standing leg. This is the last one here. And we'll switch sides. Almost there, almost done. And release. Great job. You have made it through that workout. We've just got some cool down exercises here. If you have a chair, go ahead and grab your seat. Catch your breath, deep breath in. Exhale, sigh your breath out. Deep breath in. Exhale, let it go. One more time. Great job. One more inhale, lengthen up your spine, sit a little taller. And as you exhale, twist to the left side, back to center. Exhale, twist to the right. Inhale, center. Exhale to the left. Inhale, center. Exhale to the right. And inhale, bring it back to center. Clasp your hands together. Bring your palms out front. Get a nice stretch here, stretching through your upper spine. And then press into your palms as you inhale. Lift them up overhead, shoulders away from your ears. Deep breath in. Exhale, lean over to the right. Inhale, center. Exhale, lean to the left. One more time. Inhale, center. Exhale to the right. Inhale, center. And exhale to the left. Inhale, back to center. Exhale, release. And we'll take our right leg in front of us. Toes point up towards the ceiling. Inhale, sit a little taller. Exhale, reach towards your right toes with one or both hands. resting where you can, feeling a stretch in the back of your hamstring, maybe even in your spine as well. And inhale, walk your hands back up. We'll take our right ankle over our left knee. Trying to find a stretch in our right hip. You can stay right here if you feel that. Or hinge a little forward and rest your forearms on your calf. Take a few deep breaths here. Inhale, rise up. Bring that leg down. And we'll take our left leg out. Toes point up towards the ceiling. Inhale, sit a little taller. Exhale, hinge at your hips, lean forward. Find your stretch in your left hamstring. And take a few deep breaths here. Inhale, lean forward, lean back up, and take your left ankle over your right knee, finding a stretch in your left hip. Now this side might feel a little different than the first, it's okay. If you feel it here, stay here, or gently hinge forward. Inhale, rise back up. Take your left leg down and take your hands on your thigh or your knees. Inhale, bring your chest forward, squeeze your shoulder blades together. Exhale, round your spine, bring your chin to your chest. Inhale, open up. Exhale, round. A few more rounds here. Inhale to open. Find your back bend and exhale, round. 2 more. Last one. Inhale, come back to center. Thank you so much for joining me for this week 2, and I'll see you next week.